The arrival of the coronavirus vaccine has started a conversation among some minority groups about whether they will get it when it becomes widely available. A high number of African Americans say no. One woman tells Channel 3's Joy Dukes it stems from a long-standing distrust of the government and the medical community. Joy.
Yes, Cindy, despite the fact that African Americans were disproportionately impacted by the coronavirus, there's a large number who say they don't have any intentions of actually taking that vaccine when it becomes widely available. Now, history points to a long-standing tradition of inhumane and abusive practices by doctors for the sake of research. I spoke with one black woman here in Chattanooga who shared her perspective on that, as well as a black doctor who says he's trying to get more of us to buy in.
I don't trust the vaccine, so no, not at all.
Chattanooga resident Corey Bisher is one of thousands of black Americans saying no thanks to the COVID-19 vaccine, with some 48% saying they don't trust it, according to the Kaiser Family Foundation.
I do not have a single family member that says they're going to get the vaccine.
That distrust in medical systems and the United States government runs deep, so deep that it dates back to slavery.
That is the relationship that we have had with America since we got here.
When white slave owners performed painful experiments on slaves in the name of science.
Historically, some of us consider father of GYN research did that on slave women without appropriate consent.
That was only the beginning of a long history of unethical experimentation on black people.
Egregious one that people know of, not knowing of some of the others, would be the syphilis studies with Tuskegee Institute.
In 1932, 600 men unknowingly participated in a study that lasted 40 years. Many of them died from syphilis after the known cure to the disease was withheld from them. Even today, black mothers are 3 times more likely to die in childbirth than white mothers.
There's been mistrust built up because of that.
Dr. Mark McKenzie helped lead the Moderna vaccine trial effort in Chattanooga earlier this year.
The goal was to try to make sure we proved safety in all demographics. 4% of the population in the study were Asian. Black African American made up 10% of the study. Hispanic Latinx was 20%.
He's now trying to change that stigma that has nearly 71% of African Americans feeling weary of possible side effects, according to the Kaiser Family Foundation.
Even though it seems rushed, the technology has been around for a lot of years, 15 plus years, the mRNA technologies.
McKenzie tells Channel 3 he's working with local churches to try and finally put some of those fears to rest. And if you have any concerns about the vaccine or anything that you are unsure of, McKenzie recommends you speak with a care provider that you trust to get more information about it. As for him, he says that he is planning to take the vaccine when it becomes available to he and his staff, and he's trying to encourage local churches to get in on the same. Reporting live at home tonight, Joy Dukes, Channel 3 Eyewitness News.